Hello everyone, this is Dr. Yogesh, Senior Orthopaedic Consultant from Aster Whitefield Hospital. So we all know nowadays most of the young people are coming with shoulder injuries. So today let us see what are the common reasons why the young adults are developing these shoulder injuries and what needs to be done for those situations. So one of the most common injuries is muscle strains. Muscle strain secondary to the overuse injury. They overuse without any proper warm-up. And second thing is improper techniques when they are playing certain sport. So this is the most common injury, muscle strain, followed by we have dislocations, instabilities. The patient sometimes tells I feel like my shoulder comes out and goes back inside. So that we call it instability. So dislocations, instabilities, followed by tears, muscle tears, what we call rotator cuff tears. So below the deltoid, we have some small but very important four muscles which help in our shoulder movement, including the rotations, or it be the abduction or forward flexion. So these activities, so any of these muscles could get torn. So we call it a rotator cuff tear. So definitely that needs an immediate intervention. That is also one of the most common secondary to any injury. It can be because of the exercises or sports, or it can be most commonly accidents, road traffic accidents. So these also cause rotator cuff tears. So and after that, followed by inflammatory arthritis. Any inflammatory arthritis like maybe rheumatoid arthritis or ankylosing spondylitis, any sorts of juvenile arthritis. So all these things can also lead to shoulder pain. And at last, we have referred pain. Referred pain is when the patient has a disc prolapse in the neck. Even that pain might be referred to the shoulder, and the patient might complain, or he might feel that there is some problem with the shoulder. So these are all the various reasons in young adults what are the causes for shoulder pain. So how do we go with it forward? Then we have to investigate it. First, we have to clinically examine. The first diagnosis is made with clinical examination, followed by investigations. What investigations? We take an X-ray, and then we need an MRI to see what exactly is going wrong inside. So accordingly, either it can be physiotherapy if it is tears or some serious grievous injury inside. Then we have to go ahead with the surgery. Otherwise, most of the times, physiotherapy will help us to get control over the problems. If any queries, any problems, you can always reach us at Aster Whitefield Hospital, Bangalore.